we're more an addition to the GP system that already is there. And we also cover some problems people would rather not discuss with their own GP because they know their GP for 30 years and they don't want that to tell them to them.
Welcome to the Startup Passport by Frontwalker. Today we are joined by Jaap de Bruin. Thank you very much for joining. You're a founder's associate at Mila Health. Thank you for joining. Well, in the Netherlands, there are many healthcare providers, just as in many other European countries.
Mm-hmm.
But you guys are a digital one. So what sets you apart?
What sets us apart is that we cover the whole service from the medical intake to the consultation to getting the prescription and delivered to your doorstep. And during that whole period, you also have 24/7 customer care. So you can take customer support or talk with doctors and medical chat.
So let's imagine I'm sick right now,
Mm-hmm.
and I'm one of your users. So how would the process look like for me?
Good question. So we offer a certain type of products that people search for. So we have a men's health brand and a weight loss brand. So if, for example, you have acne, you would search it on Google and we could come up quite quickly above because we are trusted. You would go to a medical intake, then a doctor would assess your medical intake, would ask more questions, and then if you're liable for the product, you would get the treatment, and that's how it works.
And for the people that maybe for the listeners that don't know how it usually works in the Netherlands or how the more traditional system works, how does that work? So also to again emphasize how you guys are differentiating yourself from what is already there.
Yeah, so normally you would go to your own GP and come there with your problems and he would assess it. But we're more an addition to the GP system that already is there. And we also cover some problems people would rather not discuss with their own GP, for example, because they know their GP for 30 years and they don't want that to tell them to them.
And healthcare itself is a fairly regulated sector.
Mm-hmm.
How was it entering that market? Of course, you're not offering any medical products then in that sense, but still, how's the landing in that sector itself?
Quite good. So from the start, we've worked together with experts and doctors and pharmacies. So whole patent process aligns with the regulations. So we're doing good.
And how does the team look like right now?
We're consisting now of a core team with 8 people. So the 2 founders, developers, and operations. We work together with now 25 doctors, I think. And we also have a customer support of medical students, I think around 10 or 12.
And can you already also say something about how many users you have then in the end?
Yeah, so right now, at this point, we treated 18,000 patients, and we now have 90 or 9,000 active subscriptions.
And what is it that you guys are looking for in order to grow that further? Of course, you're trying to grow the base of patients, which essentially are also then customers in that sense. So what is it that you need right now with the team that you have?
Yeah, so we're already scaling quite well. So we every month we see good growth. I think the most important thing of the scaling is that we remain the same quality that we offer. And in order to do that, we of course need money, as every company does, and to put into either software development, more AI solutions, and in the end also to scale, you need brand awareness. So that's the last part.
Is there any form of financing that you guys prefer in terms of having an investment from a venture capital or having an angel investor? Is there anything that you guys prefer in that sense?
Yeah, so we have already done 2 rounds, so we're quite along the way. For this round, we are looking for private investors, so for bank loans to go over a gap of time of 1.5 years to in 1.5 years do like a bigger round for like a seed A.
Did that change anything in your daily operations after you got that investment? Does that only bring opportunities, or are there also pitfalls in that sense?
How do you mean exactly?
So you said you got investments before, and does that only then lead to you having more money? So there are only positive sides of you being able to scale, or are there also negative aspects or things that get harder after you got that investment,
Yeah.
which you maybe didn't think about before that they would come up?
Good question. I think that with scaling and having more money and putting into scale, you you grow, and that's always a good thing. But when you scale, then and your company gets bigger and you have more patients, you also run into other things that needs to be fixing. So it's an ongoing thing of keeping that same quality while scaling. So that's a challenge. But I wouldn't say it as a pitfall. It's more of a it's nice to have.
The good and the bad. Essentially.
It's more good, I think,
Yeah,
because it means that if you have some pitfalls, it means you're growing and you're doing good. Yeah.
We have what we always do. We ask some quick fire questions to end the interview. So these are mostly some this or that questions. So you can just answer from your perspective. Well, subscription or a one-time fee?
Subscription.
Subscription. True or false? True or false? Digital healthcare will replace the traditional GP.
False.
Focusing on your study is important because
you learn a lot.
And in 5 years, in an ideal scenario, Mila Health will
be the frontrunner for digital healthcare in Europe.
In Europe, so you're also trying to go international.
That is one of our plans, yes.
And we will be very interested in following that. So thank you for joining the Insights and for joining the podcast. And thank you for the insights.
Thanks for having me.
And good luck with Mila Health.
Yes, thank you very much.
You.